For a long time, the province has been calling the COVID-19 vaccine the way out of the pandemic. With the peak of the fourth wave behind us, the province is looking ahead to ensure that our most vulnerable populations continue to have immunity against the virus. Today, announcing the expansion of eligibility for COVID-19 booster shots.
We're expanding eligibility for third doses to 4 groups. First, any Albertan age 70 or older. Second, all First Nations, Métis or Inuit people age 18 and older, regardless of where they live in Alberta.
The key to those booster shots is that they come 6 months after your last jab. 2 other groups are also eligible for the booster shots: frontline healthcare workers who received their first 2 doses less than 8 weeks apart, and Albertans who got 2 doses of the AstraZeneca or 1 dose of Janssen. The province says right now there is no evidence that the general population needs booster shots, but they are watching the data. When it comes to COVID and the province's reaction to rising cases at the end of August, Premier Kenney was asked about his comment in question period Monday, where it sounded like he pointed the finger at Dr. Dina Hinshaw.
I think that's a completely ridiculous misconstrual of what I said, Graham. I've always said, as I did multiple times in the debate in the legislature on Monday night, that I take ultimate responsibility as the Premier, as the President of Executive Council, for our policy. And we receive advice. When we do, we take it very seriously, and we act quickly. This is not about blame. I was simply being transparent about when we received information or advice. We've always sought to act promptly with advice that we've received, to treat that advice with the greatest of seriousness.
When asked, Dr. Hinshaw said that when she read the specific comments in context, it accurately reflected the timeline and the recommendations she brought forward. Taking a look at the COVID case numbers, 487 new cases were reported over the past 24 hours from over 10,000 tests, for a positivity rate of 4.8%. Hospitalizations are down. 697 people are in hospital with COVID, 155 of them in intensive care. Of those in ICU, 85% are not fully vaccinated. And while active cases are dropping, there continue to be deaths, 14 more reported over the past 24 hours.